The hospital wanted to reduce the bill for the surgery, but the patient insisted on doing everything by the book. So now he has to pay twice as much. Backstory. I used to work in the public relations department at a state hospital, a department where all sorts of nonsense gets dumped when no one wants to deal with it, or they just want to pass the buck. It was tough to handle the workload, especially when the department was led by a yes-man PR director who usually agreed to almost any request for help, particularly after other staff gave standard excuses like, "This involves a patient, so let PR handle it," or flattered us with, "You guys are so great at this, we'd just mess it up, you'd better take care of it." Besides the PR department, there was a medical affairs department that dealt with more complex cases: legal, complicated medical, or interdisciplinary issues. Due to the nature of the work, cases sometimes bounced back and forth between these two departments. I was partially involved in this particular case, but my colleagues strictly followed the rules. Characters: Cynthia, director of the Medical Affairs Department; Joel, employee in the Medical Affairs Department; Sarah, employee in the Finance Department; Mr. Natty, a retired patient with no income. The story: this happened almost 10 years ago, not in the USA. Mr. Natty underwent surgery, everything went well, and a few days later, he left the hospital to recover at home. At home, he carefully reviewed the bill, called the hospital about an alleged error, and was transferred to me. For confidentiality and simplicity, let's call the disputed item an organ transplant. Mr. Natty claimed no organ transplant had occurred, and he only had a couple of medical devices installed. At that point, he was still quite pleasant to deal with. I assured him I'd call back after checking, and since this case wasn't urgent, it took the finance and surgical departments about 2 weeks to sort out the details and figure out what happened. Meanwhile, by the end of the first week, Mr. Natty started sending me emails asking when he'd get the promised refund. Curiously, I didn't recall promising him a refund. Per company policy, I had to respond to every email. By the time the finance team finally gave me a detailed response about his case, I knew his email and phone number by heart, and he was getting increasingly irritated. I contacted Mr. Natty and confirmed he was right. No organ transplant had taken place. The organ transplant on the bill was actually a shorthand for a bundled service package that included many items used during the surgery, including the installed medical devices. The surgical department, aware of his financial situation, had provided a comprehensive service to save him money instead of billing each item separately, which would have been much more expensive. My response flipped a switch in Mr. Natty's brain, and he exploded. He shouted that a state hospital funded by taxpayers should act more honestly, and demanded the bill be revised to fully reflect everything done and used during the surgery, with no exceptions. Even when it was explained that this would likely result in a significantly higher bill, he didn't back down from his principles. I was still a relatively new employee, so I told Mr. Natty I'd need to consult someone to see if his request was possible and ended the call. At that moment, Cynthia approached me and asked if everything was okay. She'd been passing by as the conversation ended and stayed nearby, noticing I was upset and nervous. I told her what happened, and she kindly offered to transfer the case to her department, as they were used to handling such cases and it wouldn't be a big deal for them. I agreed without hesitation, as I was already fed up with Mr. Natty. The next day, I called him to inform him that Joel would take over his case. After that, I heard nothing more about it from Joel, Cynthia, or Mr. Natty, and I completely forgot about it. 4 years later, a major reorganization happened at the hospital. Cynthia and Joel left, the medical affairs department was shut down, and the PR department was merged with others, now handling even more nonsense. One day, Sarah from the finance department called me about a patient claiming he'd spoken with staff about a billing error, but his issue remained unresolved. Sarah wasn't sure, as the patient insisted he'd spoken with a Cassandra Gordon and me, adamantly denying it was Cynthia, Joel, or me when Sarah tried to clarify. After digging through archives and medical records, we discovered the caller was none other than Mr. Natty, and it was the same issue, but with a twist. As it turned out, when Joel contacted Mr. Natty, he tried to explain that fulfilling his demand for a detailed bill would lead to significant additional costs. Mr. Natty refused to listen and started yelling moral lectures at him. Moreover, he threatened to report the hospital's illegal actions to various government agencies and apparently followed through with at least a couple of them. I must admit, Joel was far more professional than I was. He was usually a model of calm and composure, able to handle a ton of nonsense without losing it. Mr. Natty, however, seemed to deliberately act in the worst possible way, because in my 4 years of working there, I'd never seen Joel act like this. Typically, in such cases, Joel would pass the case to Cynthia with a recommendation to ignore the request or send a formal letter and close the matter. Cynthia usually agreed if it was morally justified and didn't involve corrections or medical consequences, but this time, Joel didn't do that. He decided to fulfill Mr. Natty's request. Joel told the surgical department what happened, and, angered by how their goodwill was rudely dismissed, they agreed to make the changes. They involved the finance department to ensure every procedure, tool, and item used in the surgery was meticulously itemized in the bill. No bundled services or attempts to save Mr. Natty money. It turned out the organ transplant wasn't the only item listed as a bundled service to reduce costs. As a result, the bill doubled. Mr. Natty was furious when Joel sent him the new detailed bill. He refused to pay and spent about a year periodically harassing Joel with threats and complaints until he eventually disappeared. I asked Sarah why Mr. Natty had resurfaced after so long. It turned out a collection agency had found him. Mr. Natty had moved and hadn't updated his contact information. He also hadn't shown up for medical checkups at the hospital. Unpaid bills were eventually sent to collectors who used the contact details in the hospital's system. Years later, Mr. Natty finally showed up for a checkup and had to provide updated information. The collectors quickly learned of this and resumed the debt collection process. Somehow, I managed to muster the last scraps of my nearly depleted compassion and asked Sarah if there was any way to reverse the changes. She laughed and pointed out that, thanks to the state insurance available to all citizens, Mr. Natty's medical expenses were initially covered at about 80%, largely due to the bundled services like the organ transplant used by the surgical department. However, after his demands, the insurance only covered about 30% of the new doubled bill. The best part? Such bills are sent to a government agency, and only one change is allowed unless the hospital officially admits an error, which could lead to hefty fines. This rule exists to prevent hospitals from constantly altering bills and to reduce administrative costs. And here's the cherry on top. One of the agencies Mr. Natty complained to about our illegal actions was the very agency responsible for covering medical bills. So not only was the government agency aware of his unwise demands, but they also knew we'd tried to help him. However, we changed the bill solely at his request, and naturally, the hospital wasn't about to take on a fine for Mr. Natty's sake. With immense, genuine satisfaction, I made the final call to Mr. Natty. He didn't recognize me, but I took great pleasure in reminding him that I was the one he'd yelled at 5 years ago. Didn't he remember me? No? Oh, no big deal. It's been so long. Or maybe it wasn't about time passing, but the fact that he didn't bother remembering our names because we were just customer service staff. Fine. I didn't continue the polite chit-chat and got straight to the point, informing him we couldn't change the bill again since changes are allowed only once. Surprisingly, he didn't immediately lose it and even asked why. I explained. There was a long pause, and just as I started worrying he'd fainted, Mr. Natty exploded, screaming that it was all a lie, that we were dishonest, that he was a penniless pensioner. How could we do this to him? Why did we make changes knowing the total would increase? How could the new bill be higher? It must be a mistake, and so on. By then, I was an experienced employee and usually ended such calls after 3 warnings. Dear readers, with Mr. Natty, I didn't do that. I patiently waited until he exhausted himself shouting profanities, and in the ensuing silence, I simply said, "The bill was detailed and changed at your request." Laughter. Additional notes. Some comments suggested Mr. Natty wasn't informed of the preliminary surgery costs beforehand, among other discussions. I apologize for not mentioning these details earlier. I thought they weren't crucial since the story was already long. For clarity, Mr. Natty was informed of the approximate cost range before agreeing to the surgery. If I recall correctly, his initial bill was slightly higher due to complications during the surgery, requiring more medical items than planned. Still, the amount stayed within an acceptable range because the hospital accommodated him with bundled services. Additionally, affordable financial assistance options were available, but Mr. Natty rejected all offers when we presented them. To paraphrase his response mildly, it was something like, "What, you want me to grovel and beg for help?" "No, Mr. Natty, we genuinely just wanted to help. Honestly, at least until you pushed even Joel to his breaking point." Second note, I didn't expect to need to add this, but many people are concerned about Mr. Natty's health and financial situation. You're all incredibly kind. Let me reassure you, Mr. Natty's health and financial situation were never at risk. Some hospitals have interconnected medical databases, but their payment systems aren't linked. Mr. Natty always had access to a wide range of medical services elsewhere and would never have been left without medical care or financial support if he'd wanted it. Moreover, he could have repeated this pattern, get surgery and disappear at another hospital if he chose, gradually reducing his list of available hospitals. I'm almost certain that's what he did for those 3 years until he showed up at ours, possibly hoping we'd forgotten his debt by then. Laughter. Sorry for the inappropriate chuckle. Story 2. The pharmacy staff refused to stay late even once after their shift ended. I complained to their boss and their workday was extended by an hour. I used to work as a coordinator for pharmacological research at a hospital. In healthcare, following established laws and protocols is critical. Problems arise when people start inventing their own rules and acting on them. The hardest part of my job was convincing other departments to do their duties. Sometimes it was incredibly challenging to get even basic tasks done. Ask a nurse to draw blood into 4 vials and they roll their eyes. Ask pharmacists to stay 5 minutes past their shift? Nope, they're out the door at 4:30 p.m. sharp. This second scenario is central to this story. The pharmacy department flat out refused to stay late. I get why they wanted a strict schedule, but in a world of sick and dying people, unexpected situations happen. To be fair, I regularly stayed 1 or 2 hours past my shift to handle issues or enter data in my department. That was normal. We were calmly paid overtime or given flexible schedules. Our hospital was in a big city with harsh, snowy winters. A few years ago, a major snowstorm was forecast. Nurses, doctors, pharmacists, and coordinators like me were essential staff and had to show up for work, snow or no snow. If we didn't come in due to weather, we'd have to take sick leave. The day before the predicted snowstorm, we had a patient in our clinic. Typically, patients in this study saw a doctor first and then received treatment right after. But this patient had a job that made him prefer getting examined during the day and receiving treatment early the next morning. It was unusual, but we accommodated him easily. While most of us accepted the need to come in during the snowstorm, the experimental drugs department was particularly grumpy about driving to work in a blizzard. So, at 3:30 p.m., an hour before the pharmacy closed, they messaged me on Slack, asking if we could treat the patient today so they wouldn't have to come in tomorrow. Seriously, you're asking this now? Reluctantly, I went to the waiting room and asked the patient. He wasn't thrilled, but agreed to receive treatment now if needed. I informed the pharmacist, and they asked about the patient's status. The clinic was, as usual, running behind, and the patient hadn't yet been cleared for the procedure. The experimental pharmacy department needed at least 20 minutes to prepare the medication, so they set a deadline of 4 p.m. to receive the doctor's signed prescription. The process for getting medication was as follows. Obtain a signed prescription from the doctor after the patient was officially cleared, take the prescription across the street to the pharmacy, hand it to the pharmacist, wait for the medication, and return with it to the patient in the main building. Obviously, doing this in about 12 minutes was impossible. At 4:01 p.m., a pharmacy employee sent me a very rude Slack message saying I'd essentially missed the chance to treat the patient today and that I should try harder next time. Coordinators get blamed for everything, even when the issue stems from a doctor's poor time management. The message was something like, if you don't deliver the prescription to the pharmacist by 4:05, we can't help your patient. In the future, I should get the signed prescription in advance and hand it to them for preparation. By in advance, they meant preparing the medication before the doctor officially confirmed the patient was ready to receive it. During my training, the pharmacy director strictly warned us never to do this. It was forbidden and could lead to a massive lawsuit if anything went wrong. You can't prepare medication until the patient is officially cleared by a doctor. I really liked the pharmacy director and often consulted her about medications patients could take during studies. However, she wasn't very involved in the day-to-day operations of her staff and focused more on big-picture strategic tasks. That's why her employees started making up their own rules and demands. So I need to arrange this patient's treatment today, right now? Fine, if you insist. I got the signed prescription before the doctor examined the patient. The doctors frankly didn't care much. According to the person who sent me the message, the next step was to deliver the prescription to the pharmacist. You said I needed to get it to a pharmacist by 4:05, right? But what if, instead of going straight to the pharmacy, I went to the pharmacy director? She's a pharmacist too and could do everything the experimental drugs team could. I told the director the patient hadn't been officially cleared yet, but the pharmacists were pushing me to issue the medication early so the patient wouldn't have to come in during the snowstorm. She looked surprised and asked if the patient had rescheduled during the clinic visit. I said no, it was the pharmacy staff's request because they didn't want to come in during bad weather. I showed her the Slack message from her employee. The director was visibly upset and said someone would have to stay late if that was the plan. I showed her the message stating I'd already missed my chance since the staff wouldn't stay past closing. She was furious and declared she'd personally stay late to oversee the issue. We walked from her office to the pharmacy. She wanted to confront the employee, but of course no one was there. We picked up the medication at 4:35 p.m. and I delivered it to the patient. A week later, the patient called and said he preferred receiving treatment on Thursday afternoons instead of Friday mornings and wanted to stick to that schedule. I passed this request to the pharmacy director, expressing doubts about how we'd manage it long term. She said she'd handle it and get back to me. A few days later, we all received an email stating that the experimental drugs department would now operate until 5:30 p.m. daily, with one employee staying late on a rotating basis to handle evening medication orders. I knew there were only 3 pharmacists in the department, all salaried. not hourly, meaning someone would have to stay late more than once a week. A few weeks later, around 4:45 p.m., I went to pick up another dose for this patient. The same employee who'd previously asked me to break the rules was working. I asked how she was doing, and she replied, clearly annoyed, that she now had to work from 4:30 to 5:30 p.m. 3 times a week, likely as punishment for her unethical behavior weeks earlier. She handed me the medication package and slammed the window shut in my face. If the pharmacist had just done their job properly and come in during the snowstorm once, they could have kept leaving at 4:30 p.m. sharp. If you work in healthcare or medical research, don't invent your own rules. That's all for today's stories. Thanks for watching this video to the end or listening to these stories in the background while cleaning, cooking, studying, or whatever else you've mentioned in the comments. Check out our previous videos linked here, subscribe to our channel, and good luck.